It's not over yet. That is the clear message from public health officials in Somerset in the wake of the government decision to lift all COVID restrictions. Only last week, the Office for National Statistics said that around 1 in 25 of us had COVID. And while case numbers in Somerset are falling, they are still high. So the social responsibility on all of us to help prevent the spread of COVID is still there, even if legal restrictions aren't. One of the most significant changes announced by the Prime Minister was that there is now no longer a legal requirement to self-isolate if you have COVID. And yet, importantly, the advice hasn't changed. So if either you test positive for COVID or you're displaying any of the symptoms, including a high temperature, a cough, or a loss or change in your sense of taste and smell, you should still stay at home and avoid contact with others.
What we've learned through COVID is that we've been really good at isolating when we've got symptoms, whether that be respiratory symptoms or symptoms around a tummy bug or something like that. And that's the kind of thing that we've got to keep going through all of this now. It's really helped us to stop the spread of infection. So voluntarily now, if we are symptomatic, we should be isolating.
The most vulnerable in our community remain at risk of becoming seriously ill if they get coronavirus.
This is our vaccine fridge.
And Public Health in Somerset, alongside NHS colleagues, will support the government rollout of a 4th booster jab in the spring for those aged 75 and over, older care home residents, and anyone over 12 who is immunosuppressed.
Oh, without a doubt, the vaccination programme is our first line of defence against this virus. So I would encourage anybody, if you haven't had your first, second or third dose and you're eligible, please make sure that you get your vaccination. Absolutely.
The NHS says that across Somerset there are still options for jabs 7 days a week, and the average appointment takes less than 15 minutes. So go online to book yours or phone 119.
Can I get a lateral flow test, please?
Another change announced by the government sees an end to free testing, largely because most people have now been vaccinated. Free LFD test kits for those without symptoms won't be available from the end of March. PCR tests for those with symptoms and who are vulnerable will remain after March. From now on, most things will be a choice, and you may still feel more comfortable wearing a face covering in indoor crowded places, keeping windows open if you're meeting people indoors, or choosing to meet outdoors. But bear in mind that in healthcare settings like a GP surgery or a hospital, face coverings will still be a rule. And there will be still extra precautions in care homes because of the vulnerability of residents. I'll see you next week.